You gotta hurry up and get to class to take that quiz. Let's go. Move, move, move.
Nah, you need to take that quiz. Just go back to your room and sleep. Nope, nope. Come on. Come on. Yep, there we go.
No, don't listen to him. I'm the good conscious. Listen to me. Go take that quiz.
Alright, how about this? Let's compromise. You can sleep, but in the classroom.
Alright, that sounds good.
There we go.
And stop breathing so heavy.
Thank you for choosing Pulmonary Airlines. In case of an emergency, please use one of the two exits, either your mouth or your nose. Sit back and enjoy your trip.
Pulmonary ventilation is the exchange of air between the lungs and the environment, including inhalation and exhalation.
Within a few minutes of oxygen deprivation, severe and irreversible brain damage may occur.
Air is inhaled through the nose where the nasal hairs help filter foreign substances to prevent those particles from reaching the lungs.
It is here where air is warmed and moistened. From the nasal cavity, the air travels down the trachea, which is also known as the windpipe.
The trachea contains C-shaped hyaline cartilage rings that keep the passage open. It is lined with a ciliated mucous membrane and contains smooth muscle, which aids in contraction to assist in airflow.
From the trachea, air travels to the bronchi, which leads to the left and right lungs, where it makes its way to the bronchioles. At the end of the bronchioles lies the alveolar ducts. The alveolar ducts contains the alveolar sacs and alveoli.
The alveoli are responsible for the primary function of the lungs, exchanging carbon dioxide and oxygen. This process is done by diffusion, which occurs through the capillary walls. Elevated levels of CO2 in the blood would normally cause an increase in the rate of breathing.
Herring-Brewer reflexes protect the lungs from overinflation. Pulmonary stretch receptors in the smooth muscle of the airways respond to excessive stretching of the lung during inspiration. Once activated, they send action potentials to the medulla and pons. The medulla oblongata is the respiratory center of the brain, essential for spontaneous breathing. Pulmonary ventilation can be affected by many diseases. One of the most common lung diseases is chronic obstructive pulmonary disease, better known as COPD. COPD causes airflow blockage, which will result in difficulty breathing. One form of COPD is emphysema, which destroys the alveoli in the lung.
The lungs losing elasticity will result in the rupture of the alveoli, decreasing the surface area needed for gas exchange.
Another form of COPD is bronchitis. Bronchitis is the inflammation of the lining of the bronchioles. Mucus is produced in the bronchioles, which will eventually accumulate, restricting the passage of air.
When an asthma attack occurs, the smooth muscles outside of the bronchioles will constrict. The bronchioles then become inflamed, making it difficult to breathe. Smoking is the primary cause of COPD. COPD is the third leading cause of death in America, claiming the lives of roughly 134,000 Americans yearly.
Did you know?
The air we breathe contains approximately 20% oxygen, but interestingly, the body only needs 5%.
If your lungs were to be stretched out flat, they would cover a tennis court.
The average adult breathes 12 to 20 times per minute while resting.
We breathe around 11,000 liters of air per day.
We can live for days without food or water, but only a few minutes without oxygen. So clearly, pulmonary ventilation is one of the most important bodily functions.